and give me an example of something that relates to public health?
Money.
Money? That was good.
Hospitals.
What was that?
Hospitals.
Hospitals, yeah.
Nurses.
Nurses. How about vaccinations, 911, or even the Surgeon General warning on tobacco and alcohol products? On their 2016 updated website, the World Health Organization defines public health as the art and science of preventing disease, prolonging life, and promoting health through organized efforts in society. I'm currently a health science major with an emphasis in public health, and upon graduating, I plan on getting my master's in public health. I'm also currently in Health Science 3300, which is Introduction to Public Health, so it's kind of all around me. First, I'm going to go through the history of public health and then explain why public health is controversial, and then lastly, talk about the governmental factors surrounding public health and how they influence you, or how they affect you guys. Start off, let's learn about what public health is and its history. The history of public health can be traced back to 1854. There's actually two notable figures. The first one is Charles Edward Winslow, and he's considered the father of public health. He has written many articles and books on public health, sanitation, and healthcare administration. And the second notable figure is Jon Snow, and not the Game of Thrones character, Jon Snow. He's considered the father of epidemiology. He lived in London back in 1854 during a cholera outbreak, and because of this outbreak, he was able to conduct a natural experiment. In her 2017 textbook titled Introduction to Public Health, Mary Jane Schneider describes the data Jon Snow took to conduct his natural experiment. He looked at data from August of 1853 through January of 1854, and what he found was of the 40,046 homes he looked at, there were 1,263 related to the cholera death, and he was able to trace that back to one company, and that one water company back to one water pump that was infecting the entire town. Without the data from the British government, Jon Snow would have never been able to conduct his experiment. Nigel Paneth, a professor of epidemiology, explains in his 2004 journal assessing the contributions of Jon Snow to epidemiology. He explains that Jon Snow did not actually remove the pump, but he did alert the authorities as soon as he discovered his findings. And because with that information, they were able to remove the pump, and shortly after, the cholera outbreak came to a halt. Epidemiology is the basic science of public health. It's a result of Jon Snow's discoveries. The CDC, the Center for Disease Control and Prevention, defines epidemiology as the study of the distribution and determinants of health-related states or events in specified populations, and the application of this study to the control of health problems. Now that we've heard some of the history and notable figures in public health and epidemiology, we can discuss why public health may be controversial. As weird as it may seem, public health is actually extremely controversial. The economic impact of public health is usually felt by businesses. They feel that their profits are being affected due to the policies implemented. For example, the tobacco industry has certain restrictions on where it can advertise. It can't advertise on television or radio. The energy companies have strict restrictions on how much pollution they can put into our atmosphere. And even fast food restaurants could be losing customers due to calorie counts on menu items. Individual liberty is also controversial to the individual society. It's a matter of social interest versus inconvenience, and tragedy of the commons, which causes indirect harm to others. Moral and religious concerns are also a huge problem with a huge controversy in public health. Some religions do not believe in birth control or abortion, and some individuals actually think that vaccinations cause mental illnesses in children. After discussing different controversies that surround public health, we can take a look at the governmental factors that are embedded in public health. There are different levels and functions of government that play a big role. One of the roles is writing and enforcing laws that benefit the health of society. One of these would be mandating vaccinations before entering public schools, or even the tobacco advertising. There are 3 different levels of government that implicate public health policies. The first level is the federal government. They regulate interstate commerce. Mary Jane Schneider gives an example of interstate commerce in her Intro to the Public Health textbook. She says, the Food and Drug Administration, which oversees the extensive federal regulations of food, drugs, medical devices, and cosmetics, most of which are distributed across state lines. The federal government also creates agencies to collect data, and, for example, the Center for Disease Control and Prevention and the National Institute of Health. The second level to implicate public health policies is the state government, and the third, which is usually most felt by the general public, is the local government. In his 2015 issue of the Obstacles of Promotion of Public Health by Local Governments in New South Wales, Liza Spencer explains the job of local government is to promote health by preventing communicable illnesses and chronic diseases. He also cites a source from David Clark in his 2008 article, Bluett's Local Government Handbook for New South Wales. Clark says the local government legislative capacity to address public health comes within two broad categories: service function and regulatory function. To sum it up, public health's importance is all around us. As I continue my education, I hope to gain more insight and more information on everyday life and how public health is surrounding us. Today, I hope to inform you all with some information on the history of public health, its controversies, and how the government plays a huge role in implementing our policies. I hope you can all leave here today with some stronger understanding and notice different aspects of public health in your everyday life. Thank you.